So today we'll begin a simple primary care review on newborn care feeding. Newborn feeding. Newborns should be fed early and frequently to avoid hypoglycemia. The frequency, duration, and volume of feeds are dependent upon whether the newborn is breastfed or receives formula. Each feeding should be recorded, and if the newborn is fed formula, the volume of the feeding should be recorded. Newborn breastfeeding. Breastfed infants should be fed as soon as possible after delivery. Breastfed infants should have at least 8 to 12 feeds per day during newborn hospitalization. Rooming in, skin to skin contact, frequent demand feedings, and lactation support increases the rate of successful breastfeeding. Exclusive breastfeeding. Human milk is recognized as the optimal feeding for all infants. Breast milk benefits infants and their mothers. Exclusive breastfeeding for the first 6 months is recommended. While continuing with breastfeeding, the introduction of solid foods after at least 1 year after birth is recommended. Breastfeeding assessment. Assess the mother's knowledge and concerns. Assessing the mother's understanding of breastfeeding and identifying common concerns about breastfeeding can help the clinician focus on counseling and support for the mother. Identifying mothers at risk for breastfeeding problems. Women with risk factors for breastfeeding problems include pain, low milk supply, previous surgeries, or flat/inverted nipples may benefit from lactation consultants. Support breastfeeding. Most mothers produce enough milk for their infants if they have appropriate education and support. These include avoiding formula supplementation, frequent feeding and emptying of the breast, and avoid artificial nipples. Formula feeding. Healthy newborns who are fed formula should be offered standard 19 to 20 kcal per ounce, which is also 19 to 20 kcal per 30 milliliters, iron containing infant formula. They are fed on demand, but the duration between feedings should not exceed 4 hours. The volume of feedings should be at least 0.5 to 1 ounce, which is also 15 to 30 milliliters, per feed during the first few days of life. Human donor milk. Pasteurized human donor milk may be available in some nurseries for a healthy breastfed newborn who may require additional supplementation. Thank you.